start. So I'm Abby, I'm from Haemochromatosis UK. Welcome to our Q&A with the Northern Irish Blood Transfusion Service. Just so you all know, this is being recorded, so you will be able to watch back later if you'd like to. If you have any questions and you haven't already emailed them in, there is a Q&A box at the bottom of the screen. If you type the questions in there, and we'll get back to them at the end. So without further ado, I'll pass you over to Asma. Thank you.
Hello, everyone. My name is Dr. Asma Sadiq. I'm a member of the medical team in Northern Ireland Blood Transfusion Service and run the Haemochromatosis donor program here in Northern Ireland at the Blood Transfusion Service. I will just give you a brief presentation. Can you see the slides?
Yes, that's fine. That's great.
Okay, so this is a presentation about why and how should someone with the diagnosis of genetic hemochromatosis can donate blood in Northern Ireland. So my presentation is just briefly, first of all, is an overview of the condition, genetic, or we call it hereditary hemochromatosis. And the second and the most important part of the presentation is to discuss how people with genetic hemochromatosis resident in Northern Ireland can become blood donors. The background is important because I need you to know what is the true condition of hemochromatosis and who are the carriers, and what is the difference between both of them, and who should donate blood and who should donate blood more frequently. So genetic hemochromatosis is caused by a faulty gene, and this gene affects the iron absorption in the body. And this, if there's more iron absorption, will lead to overload. And someone is at risk of developing the condition if both of your parents have the faulty gene and you inherit one copy from each of them. If you inherit one copy, you are a carrier, and you should not be at risk of iron overload due to genetic hemochromatosis. And this condition is more prevalent in the people of white Northern European background, and is particularly common in countries where lots of people have a Celtic background, such as Ireland, Scotland, and Wales. This condition has been labeled and called as a Celtic curse, but as per blood transfusion service people, for us, the people with genetic hemochromatosis, you are chosen to help patients with the gift of your blood. So you actually are Celtic angels. So the most common gene involved is called the HFE gene. It has various variants, but the important one which we test are the C2A2Y and H63D. This C2A2Y is the most severe of the two variants, which we test more commonly. And this C2A2 variant is most common in people of Celtic descent. There are other variants of this gene which can be involved, but generally we do not look for those unless there is evidence of excess iron and common variants are normal. And if someone has got high ferritin levels or high iron levels, and we do the genetic testing for C2A2Y and HC3D variants, they are normal, then we go for the other variants. Briefly, normal iron physiology is that normal daily diet contains about 10 to 20 milligrams of iron. The average adult male has about 1,000 milligrams of stored iron, which is enough for about 3 years, whereas women on average have only about 300 milligrams, which is enough for about six months. And we know the reason that the women in their reproductive age, they lose blood and hence iron every month. About 70% of your body's iron is found in the red blood cells of your blood called hemoglobin, and in muscles called myoglobin. So that is why the patients with the hemochromatosis, they tend to have high hemoglobin levels as well. But the most important diagnostic marker is the ferritin, which is the cellular or the storage iron form. Plasma ferritin is an indirect marker of the total amount of iron stored in the blood. Hence, serum ferritin is used as a diagnostic test. So 70% of iron is stored in the form of hemoglobin and myoglobin, and the rest is stored in various organs. The most important ones are liver, pancreas, joints, heart. And plasma ferritin is we test the amount of plasma which is circulating in blood as a diagnostic test. High serum ferritin levels are also seen with hypoxia and inflammatory conditions such as hepatitis, alcohol excess, fatty liver, and some cancer. So serum high ferritin levels is not always associated, though most of these cases associated with hemochromatosis, but could occur in other conditions. A single donation of blood or a venesection, it results in a loss of about 220 to 250 milligrams of iron. So when to see your GP? If you have a Northern European family background and have these symptoms, which I will just tell in the next slides, persistence of worrying symptoms that could be caused by hemochromatosis, you should make an appointment with your GP. Or a parent or sibling with hemochromatosis diagnosed with this condition. Even if you do not have symptoms yourself, you should contact your GP for tests. Common symptoms include, they usually start between the ages of 30 and 60. Below, and in teens and 20s, usually people don't present with the symptoms. And usually the males present first as compared to females in the reproductive age. The most common symptoms are feeling very tired, fatigue, weight loss, weakness, joint pains, sexual dysfunctions, erectile dysfunction in males, and irregular periods or stopped or missed periods in females, mood swings, brain fog, depression, and anxiety. So when you present to the GP, he will order a few tests, which include full blood count, liver function tests. We do the liver function test to see if the liver has been affected by the iron overload. A transferrin saturation test. Transferrin actually is a carrier protein to which iron is bound. So it helps in carrying iron after absorption in the circulation to either to the red blood cells, to the muscles, and to liver, pancreas, and the joints or other organs in the body. So a serum ferritin level test is the diagnostic marker, the diagnostic test to check the amount of iron stored in your body. After these blood tests, and if the high ferritin levels and the high transferrin or the transport protein, which is transferrin, high levels are detected, then the GP will advise for the gene tested to confirm whether you have the true condition. If you carry one copy from your mother and one from the father, or just a carrier, if you carry just a copy from one of your parents, or you don't, the gene test is negative, it means that it is something else and not genetic hemochromatosis. But if a diagnosis is confirmed as genetic hemochromatosis, then this gene testing or genomic test is offered to your first degree relatives, which are parents, siblings, and adult children. Partners are also could be tested if required to determine the offspring risk. So to check if the condition after the diagnosis of genetic hemochromatosis, some other few tests are done to check if this condition has caused any organ damage, which is liver ultrasound or MRI scan of the liver to see the health of liver, an ECG or echo to check your heart, a rheumatology assessment to check for joint diseases, an endocrinology referral to check for diabetes or Addison's disease, and a DEXA scan is performed to check for osteoporosis or your health and joints condition. So when your blood tests show a high ferritin levels, but the gene test is normal, as I already told that there could be other causes of high iron level, which could be long-term liver disease, conditions that need more frequent blood transfusions, such as sickle cell disease or thalassemia, alcohol misuse, excess iron intake from supplements and injections, patients on long-term dialysis, and some rare inherited conditions that could cause high iron level. So now the most important part is the treatment. There is currently no cure for hemochromatosis, but there are treatments that can reduce the amount of iron in your body. And the treatment is either, and the common is venesection, and where venesection is not possible in people with fragile veins or poor veins, then chelation therapy is offered, where some medicines are given that reduce or remove iron from the body through urine or stools. As a result of this treatment, it will help relieve some of the symptoms and reduce the risk of damage to organs such as the heart, liver, and pancreas. So venesection. So what is venesection? It is removal of blood from the body that could then lead to reduction of iron stores in the body. This usually involves a period of de-ironing, which we call de-ironing phase or the treatment phase, where more frequent venesections or blood donations are given, followed by the maintenance treatment or maintenance phase, which is just like the normal blood donors. You can donate blood 3 to 4 times per year. And the amount of blood removed on each occasion is similar to that donated by blood donors, which is 500 mils. And this blood, if venesection is carried out in a blood transfusion service, this blood will then be used for the patients requiring blood transfusion rather than being discarded as it's done in the hospitals or the clinical settings. Now, the question is, which genetic hemochromatosis patients can become blood donors? As we know, the blood donors are the healthiest population. The same applies to genetic hemochromatosis. We consider them also as the healthiest population until and unless there is end organ damage. And for blood donors, they have to meet the eligibility criteria as laid down by the donor selection guidelines. And these guidelines are made to ensure the health and safety of the donors, and also to ensure that blood is safe for the patients receiving it. You need to meet the minimum hemoglobin requirements, which is 125 grams per liter for females and 135 grams per liter for males. And usually it is the same or higher for the hemochromatosis people. And in general, you must be fit and healthy with no major illnesses. And age thresholds are the same as for regular blood donors, which is 17 years of age is the minimum age requirement, up to 66 birthday for the first-time donors, and up to 72 years for a returning donor. And by returning donor, we mean a donor who has given donation in the past, maybe many years ago, maybe 10 years ago, 5 years ago, and now comes back to donate. So the age limit is up to 72 years for those donors. And regular donors, they can continue donating blood as long as they can over the age of 70. We have the blood donors who are in their 80s as well. Minimum weight of a blood donor, whole blood donor, is 50 kilograms. And these donor eligibility criteria can be seen on the Northern Ireland Blood Transfusion Service website. And the question is now, how do I donate blood to the blood transfusion service with the diagnosis of genetic hemochromatosis? We need a referral from the specialist or consultant who's looking after your condition to assess your suitability for the program. That is, when we get a referral from the specialist, we will see whether you fit as a regular blood donor or a normal blood donor and fulfill the eligibility criteria based on your age, on your health, or whether you have any history of an infection or blood transfusion in the past. So we assess the eligibility. This applies to patients in both de-ironing and maintenance phases. If you're accepted for in our hemochromatosis program, NIBTS will contact you, will send you a letter to arrange an appointment. The donors, when you come and we get you enrolled, we will start calling you donors. Of course, you are hemochromatosis person. When you see your clinician, they will call you patients. But when you come to donate blood with us, we will call you genetic hemochromatosis blood donors. If you require de-ironing, we will ask you to come to the Belfast headquarters every 6 weekly to donate blood. And if you're in the maintenance phase, you have your choice. You can either come to the NIBTS Belfast headquarters, or you can donate blood at your local community blood donation sessions. So what information is required on the online? We have a system of referral. We accept the referrals, either an online referral, which is available and come in the next slide for your consultants or the specialists to contact us by online referral form, or send us the paper referrals. And it should include the following information: confirmation of genetic hemochromatosis diagnosis, confirmation that there is no end organ damage and you are fit and healthy, your medical history and details of any medications you are taking, results of your recent iron profile. If you have a very high ferritin, that is ferritin greater than 1,000 international microgram per liter, we need to ensure there's no end organ damage, and we need to know that your liver ultrasound and all those tests has been done and given all clear by the consultants. We also want your clinician to set up frequency of venous section for you, whether you need a 6 weekly venous section or once every 3 months, 4 months. Some donors, patients also get sort of like 6 monthly venous sections, but this all will be determined by the consultant. And we also need assurance from your consultant that consultant will continue giving you specialist care, who will be responsible for your iron levels and able to offer alternative venous section facilities whenever, for any reason, the donor does not meet all the eligibility criteria. Sometimes the donor who already enrolled and start donating with NIBTS, while donating with us, they undergo some investigation or develop some condition like a stroke or some heart condition. Then we let your consultant know that we will no longer let this donor donate with the transfusion service, and they need to have these venous section facilities with themselves, so that when we say no in any case or in any situation, then they will accept you, so that there's no break in your frequency of blood donation or venous section. So if you wish to proceed to donate with NIBTS, you need to speak with your hospital consultant to send us a referral, which could either be a paper referral or complete an online referral form, which is the link on the NIBTS website. And if you meet, when we get that referral letter or online referral, we will review your eligibility and then send you a letter to book an appointment with us. In case we don't accept your referrals, we will write to your consultant, say, because of this reason, this person cannot donate blood at a blood transfusion service, and they have to arrange the venous section facilities with themselves. The most important question: who will be responsible for my medical supervision or the continuity of care? So please note that all genetic hemochromatosis donors remain under the care of the referring consultants for monitoring of the condition and the determination of the frequency of venous section. They will be checking your iron levels and will be advising you whether you need 6 weekly or more, or 3 or 4 monthly venous sections. We will just follow the advice given to us by your referring consultant. And also note that NIBTS does not perform iron studies and unable to monitor iron levels or provide any patient management. We only do finger prick test at the session on each visit to ensure your hemoglobin level is satisfactory for donation. So, can you be deferred from donating blood at NIBTS? Yes. It's not just you have hemochromatosis. We do the deferrals every day on our regular blood donors as well. And there are a number of reasons because we have to follow the blood donor selection, blood donor guidelines. And sometimes we have to defer a donor following the guidelines that include foreign travel or a travel to a malarial area. If the donor is suffering from an infection, recent surgery, medical investigations. So there could be the reasons of a temporary deferrals, and there could be some reasons where we do the permanent deferrals on our blood donors. If there's a history of blood transfusion in the past, the history of heart disease, heart attack, stroke, cerebrovascular diseases, autoimmune diseases, we don't accept those donors and put a permanent deferrals, okay? So yes, there could be deferrals while you start donating blood at NIBTS. All donors are asked about these on health check questionnaire each time they come to donate blood. And we recommend that you confirm eligibility to donate each time prior to making a booking on the NIBTS website so that there is no problem with your donation when you come. And every time when you come to donate, make sure that you've checked eligibility and are able to make donation instead of just coming and wasting your time. And of course, if you're not eligible, we will not take your donation on that day. What happens if I have a query, you have a query regarding my genetic hemochromatosis management as a donor while donating blood at NIBTS? Unfortunately, NIBTS medical team will not give advice on frequency of donation, review of iron profiles, or provide any patient management. This will be done by your consultant or the specialist. So you need to speak or contact your specialist if you have any questions. NIBTS medical team will only review and assess your eligibility while you come to donate at the session, or if you have any questions of your eligibility at the time when you come to donate blood, or if they feel that there is a case of a permanent deferral. You need to speak with your specialist or your consultant. It is his or her responsibility to advise you if you have any questions about your iron profile, when to give iron for studies, what is your most recent iron, ferritin levels, when to increase or decrease the frequency. This will be all advice to us and to you by your referring consultant or supervising consultant. So now, if you want to become a blood donor, so you're interested in joining our NIBTS genetic hemochromatosis panel, please ask your hospital consultant, as I already spoken in the previous slides, to do or complete an online referral form, which is present on NIBTS website, or send us a referral letter. We will be in touch with you after this is received and reviewed by NIBTS medical team, and all this general inquiries, appointment line, information about the hemochromatosis donor, how to book, all are available on NIBTS website, which is which is at the top, Northern Ireland Blood Transfusion Service. And you can see on the very first page, click here to book appointment, and online booking for blood donation appointments line, donor inquiries, all information is available on NIBTS website. And you can also see and watch on NIBTS YouTube channel the stories of the patients who got benefit and their lives were saved by your gift of blood donation. So these are very interesting and good to watch. And I would say that from Celtic curse to super donors, you are making a difference. Thanks for being warriors and saving lives. You are superheroes. Thank you very much. And I expect that you should speak with your consultants and try to get referrals for NIBTS to become blood donors and start donating blood with us. Thank you very much.
Thank you very much for that. That was incredibly informative. We'll go on to the Q&A now. There's a couple of Q&As that have come in via Zoom, but what I'll do is I'll wait and see if a couple of more wanna come in. And I'll read one of the questions I got via email. Is that okay?
Yes.
Brilliant. So this one says, could I please have a clear outline of the timescale for sessions not held in headquarters? As a female with haemochromatosis who has been attending headquarters for the past 16 years and who has now moved house and finds attending outreach sessions much easier to manage, I have found the different rules that are told to me each time I attend more than confusing. Also, is there a rule about how many times a female can donate without being told they have to wait a year before donating again?
So about the sessions, you can check all the sessions on the NIBTS website. And I have given you the number of the donor inquiries of the general inquiries. You can just contact those and ask, like if you're living, let's say in Ballymena, you can ask them how many times in Ballymena the session is coming and the dates, and they will let you know, okay? First thing about the session. And secondly, you have been donating at the headquarters and now go to the sessions. When you go to donate at the sessions, we will take you as like a normal whole blood donor, okay? And a normal whole blood donor and the females can donate every 16 weeks, and for males, it is every 12 weeks. And we put you in a whole blood panel when you start donating in the session. Why? So that you continue getting, the reminder texts and about the sessions near your house, just like the normal whole blood donors, so that you don't miss a session near your house. And I don't know what sort of problems, if you have any problems, you can contact NIBTS and try to speak with me, and I'll see what problems you are being encountered while you go to donate blood at the session. So I think everything is going well for most of the donors at the sessions. But if you have any specific questions, you can phone NIBTS and say you want to speak with Dr. Sadiq, and I will listen to your specific concerns while donating blood at the sessions. But the number of blood donations is just like the normal whole blood donor at the session. If you need more frequent, like if you want to donate 5 or 6 times a year, then you have to come to the Belfast headquarters for that.
Brilliant.
Hope I have answered
your question.
Sorry. Yes.
No, brilliant. Thank you. You were very thorough. I'm sure you have, Leslie. Thank you. I'll go over to the Q&A box now. We've got a few questions in here. First question was, what are the obstacles to having blood that is venesected in the Royal Hospital used by the NIBTS? Can you not park the bus outside or have an embedded team to collect it?
Blood safety is very, very important. And this is not just the NIBTS and the other transfusion services as well. The blood, when it's collected, we need to treat that blood and store in special bags, and some anticoagulants and all those things are added so that it doesn't clot. And it has to be stored at a very right and accurate temperature. And those facilities are not available in the Royal Victoria Hospital and all those transfusion facilities outside and in clinical settings outside the blood transfusion service. So it needs to be done at the right temperature, right environment. It continuously need to be shaking whenever we need the blood. It's not just that it's collected. We need to be the special arrangements, of the collection facilities that is available at the collection facilities and the temperature. So we cannot at the minute do that at the Royal Victoria Hospital Hepatology Unit, and it's not possible to transfer to take the unit and take the bag and transfer it to NIBTS, though the distance is very short. But even during that time, and it cannot, because first of all is that it was not taken in that environment where that needs to be continuously, being shaken, the blood bank bag, first of all. And secondly, it will not be stored. We cannot guarantee the storage is at the right temperature. And we cannot take any risk because of that location. Because whenever we take the blood, first of all, we need to ensure with the nurses that it is done in a very sterile environment, because to prevent infection. And secondly, the blood banks when it's being taken, it's just continuously being being moved so that it doesn't clot. A proper anticoagulant is added to the bag, and immediately after it is taken, it's stored at the right temperature. At the minute, that facility is not available, even though the distance is not that much between the hepatology unit in the Royal Victoria Hospital and NIBTS. We expect the donors who can come to Royal Victoria Hospital and want to donate blood at NIBTS to the transfusion service. Since you are expecting the blood bag to go from Royal Victoria Hospital to Belfast City Hospital or the transfusion service, we expect the donors, especially in the maintenance phase, if they can travel instead of going to the Royal Victoria Hospital, to come to the Belfast City Hospital, where the NIBTS is located.
Thank you for that. And said that they'd been told that a butterfly needle can kill blood cells, and that the time to take the blood slows down, and that's why they weren't able to donate, essentially.
Yes, whatever they have explained to you in your terms, could you just contact me, and I will see whether you are eligible to donate or not, because you are explaining in your terms. So could you just speak directly with me, and I'll explain whether you are eligible to donate now or not. Just I have given just go on NIBTS website. There's general queries helpline. Just say that you want to speak with Dr. Sadiq. Call me and I will tell you whether you are eligible to donate as per most recent donor selection guidelines. Is that okay?
Yes, thank you. Thank you for that. Someone has asked, will these slides be made available?
Slides?
Yeah, will the slides be made available?
Of course. I'm happy to share the slides with you.
Fantastic, fantastic. Yeah, if you send them to perhaps our office email after this, and we'll have a look at ways to share them. Thank you. This next person says they're newly diagnosed and they had their first venesection last week. They're also thanking you for such an informative and hopeful session. She knows her nurse has made a referral for blood donation. Is it when her levels get below 50 that she can start to donate? Her current levels just below 900. I believe she means ferritin levels when she says her levels.
Yes. I don't know whether you have donated with NIBTS or in your hepatology unit or in the hospital setting. In NIBTS, our minimum frequency of venesection is 6 weekly. With your level of 900, maybe you have, in the hospital, you would have started 2 weekly venesections, or with a 6 weekly venesection, it will take time. I know there's a very long waiting list to go into hepatology and start donating 2 weekly. So in NIBTS, we have started receiving referrals from hepatology with many donors whose ferritin is less than 1,000 to start donating with us 6 weekly. That will take slightly longer than if you go and donate every 2 weekly, but still your levels will not rise, and you have started treating your own condition, plus also you started giving gifts to other patients and saving other patients' life. So very good, yes. So we expect actually the levels to be to go into maintenance phase, though ideally we said it's a 50-50. 50-50 means that the transferrin saturation is less than 50 and ferritin less than 50. But now many consultants between the ferritin levels of 50 and 100, they ask the donors or the patients to start donating 3 monthly. They put them in the maintenance phase. But from my experience, I would say I've seen many hemochromatosis patients, or I call them donors since they come to NIBTS, that they want their levels to be ferritin levels to be between 20 and 30. They would say, if my levels goes between around 50 and 60, I start getting joint pains and this. So I would say every person is different. The physiology is different. The experience of symptoms is different. But in our term, from NIBTS, and what the consultants who do the referrals, their target is 50-50, transferrin saturation less than 50, ferritin less than 50. But many of the donors now, I've seen the consultants have started advising to go in the maintenance phase between 50 and 100 for ferritin.
Thank you for that. The next question was, I've been diagnosed since 2006, but my GP forgot to tell me. Unfortunately, I finally commenced venisections in 2024, but I have been on a waiting list for a consultant since then. What can you do if your consultant still hasn't seen you yet? I believe that means in respective to potentially starting blood donation.
Yes, I don't know which trust you are in, because in Belfast Trust, they have recruited now a specialist nurse, hemochromatosis nurse, who is reviewing all these referrals for hemochromatosis, and they are working with us with NIBTS, and we have started receiving a lot of referrals on the waiting list, from the waiting list, especially those who have the ferritin levels less than 1,000, and they don't need extra testing. So they have started sending us those referrals to start donating with us, at least to start with the 6 weekly venisections. So I don't know which also, but I would not say anything to do this or to go private or to wait longer. But for the Belfast, at least they have started doing something more for these waiting lists to reduce the waiting lists. We do get referrals from the private sector as well, Dr. Joni Cash and a few other consultants to private hemochromatosis referrals to us. And when we get that referral, we start doing the venesection, start as advised by them about the frequency, whether it is 6 weekly or the maintenance phase. But I will advise for those people who are diagnosed with hemochromatosis, if your levels, go to your GP, and if you have been diagnosed as a true hemochromatosis, but your ferritin levels are still not very high, it is less than 300 or less than around 250 to 300, okay? Though we will not enroll you into hemochromatosis panel, you can just get enrolled online as a normal whole blood donor and start donating blood with NIBTS as a normal, regular whole blood donor. Only if your levels are very high, we need a referral from the hospital consultant. If the levels are normal and you have been assessed by your GP, your levels are normal, you can just start donating blood as a normal whole blood donor. You don't need a referral. And even if you have got a true C2A2Y homozygous gene mutation or a true hemochromatosis, but your levels are still within normal range, I would advise you to get enrolled online NIBTS website as a normal whole blood donor and start donating blood as a normal person, normal blood donor.
Thank you. That's great news. Thank you. The next question, how long will it take to get a decision from sending in a referral letter to NIBTS and getting a decision to attend a donations session?
As we get referral today, online referral, the secretary will forward me the letter, or I'll see the letter referral. We don't delay. We just take, but if the secretary is on leave, let's say 2 or 3 days, maximum up to 1 week. Whenever we got the referral, I would say we will respond to the referral. We delay, we take no time. We will do the assessment in just 1 day, okay? In just few minutes, okay? I would say, because your consultant has provided us this person has got this level of ferritin levels, no history of blood transfusion, everything's fine, not attending any clinic for cardiology, anything, all clear. I will say all tick boxes, yes. Answer is yes, accepted into NIBTS donor panel. So we don't delay at all. We will send you, as soon as we get the referrals, we send the letters to the patients, to the patients or the donors as soon as possible to book and ask them to book an appointment. From our side, there will be no delay.
That's great. Thank you. Oh, we've got 2 more questions. I have previously been referred to NSBT and had bi-weekly venisections, then was refused this frequency, and asked to seek alternative place to have I don't know whether that means donations or
Alternative place for
venisections.
venisections, yes, okay.
There we go.
Facilities for venisections.
I'm seeing a consultant who gave initial venisections. I am now in maintenance requiring venisection every 3 to 4 months. Would I need another referral back to the blood transfusion service from my consultant if I wish to give blood again, or can I just come back to one NIBTS for a 3 to 4 months donations if I of course meet the criteria? So yeah, would they need another referral?
No, we don't. First of all, I don't know why were you sent back from NIBTS to the clinical setting. I don't know the reason, okay? I need to know the reason. Could you just contact me again? But if everything is fine, let's say you were sent back to the clinical setting, maybe you have the poor veins and you were whatever. But again, I would say speak with me, and if I think that everything is fine with you as far as the eligibility criteria is concerned, you don't need a referral. I will make you active and you can start donating with us, start donating as a maintenance dose hemochromatosis donors with us. I won't need any new referral. But I need to know why were you sent initially from NIBTS to the alternative venesection facilities.
Brilliant, thank you. This was going to be our last question, but a question snuck in afterwards. There's two more.
No problem.
Can you donate with high blood pressure and fatty liver disease?
You can with high blood pressure?
Yeah.
Yes. Or with high blood pressure, yes. And fatty liver disease, yes. But everything is fine. A lot of people have got fatty livers, but fatty liver disease, and yes, you can donate. But it's a liver disease is that where you are attending regular hepatology clinic because of that, or it is a severe disease, then it's a no. But with fatty liver, yes. And with high blood pressure, yes, you can donate blood. A lot of people are taking high blood pressure medication and they can donate blood. The only thing is that if you are put on a high blood pressure medication in the last 4 weeks, we will not accept you for 4 weeks. We want your blood pressure, or there is a change in dosage, increase in dosage during the last 4 weeks. They will always ask you what medication you are taking. If you say high blood pressure medication, the next question would be, is there any change in the dosage, or you put a new medication during the last 4 weeks? Then we will not accept you just for the 4 weeks, because we want from the change in dosage or medication for 4 weeks to wait for 4 weeks, and then you can donate blood. But answer is yes, you can donate blood with having blood pressure and with fatty liver.
That's great. Thank you. Thank you. And the last question, why can't GPs refer instead of just consultants?
We had been having these GP referrals in the past, okay? But the problem was that after that, a lot of patients, were they were put on the waiting list for the hepatology as well. But what happened was that they did not get their scans and the follow-up and all those things from the hospital consultants. And there was a lot of complaints started coming from the hospital side as well, because they send the referrals to the patients. And when their turn comes, some of the donors, they don't bother to go, or there was some sort of disparity between the GPs and the hospital consultants, regarding the results and reviews and all those things. But I would say if you have so we have stopped accepting referrals from the GPs, so that we know that all the referrals are coming from the hospital consultants, as it's done by the other blood transfusion services. Only NIBTS was accepting GP referrals till 6-7 months ago, okay? Now, in line with the other transfusion services, England, Scotland, and Wales, they accept referrals only from the hospital consultant or the specialist of the disease. So to ensure the safety of the patients as well, that they have got a green signal that they are happy to send this patient to blood transfusion service, and this patient does not need extra testing. This is also to ensure your health and safety, so you are not missed. You need extra testing, that will be done by the hospital consultants, okay? But if your levels are not very high, as I already had said that levels are between 200 and 300, and you are diagnosed with hemochromatosis, you have got the gene C2A2Y, or whatever, you have got the iron overloading gene, don't need, even your GP sends us a letter, we will not enroll that this person has got the gene for genetic hemochromatosis. Iron, these are the ferritin levels, which of course will find between 200 and 300, not very high. We will ask, we will not enroll you then and into hemochromatosis panel. I will send you a letter, say, okay, you can book an appointment like a normal whole blood donor and start donating blood with us, okay? And your GP will continue monitoring your condition. This is only we need the referrals from the hospital consultants if you had high ferritin levels, you have hemochromatosis gene, you have high ferritin levels. We need a referral from a hospital consultant or a hospital specialist, or you have now normal ferritin levels, but in the past you needed treatment, which means 2 weekly or more frequent venesections, okay? Somewhere in the hospital or in the GP settings, then we need a hospital consultant referral who has to ensure us that this person has been seen or reviewed or had been attending their clinic in the past where you got the treatment, 2 weekly venesections. Now you are in the maintenance phase and he lets you go and donate blood in the blood transfusion service. Recently diagnosed, normal ferritin levels, not very high ferritin levels. Just ask your GP. If you think this levels are still between around 150 or less than 200, you have the gene of the hemochromatosis, just book online, go. Don't need a referral or anything. Go online, book as a normal whole blood donor and start donating blood with us. And just be very vigilant. Be the master of your condition, okay? Just learn this sentence. Be the master of your condition and not the slave to your condition. Master of your condition means you've been diagnosed with genetic hemochromatosis. You know your levels. It is less than 200. You start donating blood with NIBTS. You are keeping an eye on your ferritin levels. You are getting your ferritin checked every year. You know the levels are still within normal range. Continue donating blood with us. If you think your levels are high, just ask your GP to make a referral to the hepatologist or a consultant. Okay.
Thank you very much. That was our last question. I don't think anyone snuck through at the end. So thank you so much for taking the time to be with us today.
And if you still have any questions, just contact and speak with me on get number, helpline number, NIBTS website, and I will be very happy to answer your questions and queries.
Brilliant. Thank you so much. Yeah, thank you for taking the time to be with us all today. And thank you. The slides were really great, and I'm sure everyone's gone away knowing that they've learned something today. You were incredibly thorough with your question answers as well, so I'm sure everyone really appreciates that. Thank you as well to everyone that joined us today. As I said, this session is being recorded, so providing nothing goes wrong when it comes to saving it, it should be available to watch, rewatch. And I believe Dr. Sadiq is going to send through the slides as well, so we'll try and get them sent out as well. Brilliant. Well, thank you, everyone, and thank you, Dr. Sadiq, for joining us today. We really appreciate it. Thank you.
Thank you very much. Thanks.
Bye, everyone. Bye.